Hi, this is Dr. Butch Rosser, and we're here with the first episode of the Dr. Redan channel. And we're here with my esteemed partner, Dr. Jay Redan, who is getting ready to go on a Society of Laparoscopic Surgeons trip to China. And Jay, we're really excited about you going over there and spreading the gospel, if you will, about how we like to do things. Jay is going to be the new president of SLS, and I've been blessed to be that a couple of years ago. Jay is now in line. And Jay, tell us about the purpose of this trip and going to China, because you're not new to China. You've been in China a while.
Actually, this is my fourth trip to China. We've traveled 4 times over the last 10 years, really, to share our technology in minimally invasive surgery, initially starting with laparoscopic colectomy back in 2003. We've had people from China visit us here and spend months interning and kind of mini fellowships with us from China. I've also been blessed to have received a Chinese medical license, so I'm allowed to practice over there.
That's hard to do. Okay, good.
So we've also visited them, talking about natural orifice and incisionless surgery. And this visit is our first joint meeting between the Chinese Minimally Invasive Laparoscopy Society and SLS.
Well, Jay, I know that part of your mission as president, we all have to adopt some mission. You want to further that outreach around the world that SLS has been able to establish, and you've been on the forefront with for many years, correct?
Yes, our colleagues in China have wonderful advances in medical technology and in minimally invasive surgery in general, and to share this technology between our two countries is a benefit for both the Chinese citizens and our U.S. citizens as well.
Exactly, and it's all about the global resurgence or exposure to laparoscopy. Now, tell me, do you have an agenda yet there as far as what we're going to try to do while you're in China?
Yes, myself and my urology colleagues and gynecology colleagues, we're each going to be spreading our expertise in our disciplines. For myself, I know I'm going to be talking about gastroesophageal reflux disease, the ability to use laparoscopy in an emergency situation where people traditionally would get opened up, and also to expand our telesurgical capabilities between China and the U.S.
Well, that's a huge agenda. What are those dates again, Jay?
So we're going to be there, leaving the U.S. on May 30th, arriving in Beijing May 31st, and we'll be in Beijing and Nanjing throughout those 2 weeks, in a variety of lectures and meetings with interdisciplinary meetings between surgeons, gynecologists, and urologists.
Well, I'm looking forward to seeing you virtually. And folks, this is the first episode of the Dr. Redan channel, and what we're going to do is look forward to a pictorial report. Stay tuned for the next episode.
Thanks.